Welcome to Hearing World. My name is Sangamesh. I'm an audiologist by profession. I make videos related to hearing loss, hearing aids and other related topics. In today's video, I'm going to show you how to put the receiver and the Canal hearing aid in your ears properly. This is something I work with my clients during the feeding session. I explain them how to put the hearing aids on. So I put it on myself and then I tell them to do it themselves in their ears. So I can see what they are doing wrong, so I work with them to make sure that they know how to put the hearing aid properly in their ears. So it's still a challenge for some of my clients, especially if they are old and if they have dexterity issues or if they have arthritis. So it can be a challenge to put the hearing aid properly in the ears. So it is important for you, if you have difficulties keeping the hearing aids in your ears, so you're not alone. There are a lot of people who have difficulty with this. So you need to let your audiologist know what difficulties you have with respect to keeping the hearing aids in your ears, so they can work with you to find a solution. So they might look at a different style of device, or they might make a mold for you, so it's easier for you to put the devices in. So in this video, I'm going to first show you how to identify the right and left hearing aids. So depending on the model and the device, they should have a marking of blue and red on them. So in this device, as you can see here on the receiver, it's in blue. So there should also be another mark just for you to identify which one is right and which one is left. So if you see the blue color marking, it's for the left hearing aid, and if you see the red color marking, it's for the right hearing aid. So there is also other ways to identify the right and left. So if you have used hearing aids, you would know just by looking at it. So as you can see here, if I'm holding the right device in my right hand and the left device in my left hand, see how they are facing each other. Whereas if I'm holding the left device in my right hand and the right device in my left hand, they are facing away from each other. So that's wrong. So they have to face each other, so you know that this hearing aid goes in your right ear and this hearing aid goes in your left ear. So this is how it goes in your ear. So this portion goes in your ear, and then this portion here goes behind your ear. So I'm just gonna put this on myself just to show you how to put this on properly. So what I would usually suggest is to hold it here and then slide it on top, so that sits on the top first, and then you hold this portion here and then push it all the way in your ear canal, as far in as possible. So now after a while, if it is not going in properly, then you can use your little finger and then try to push it all the way in, so that this thin tube here, it has to be next to your skin. So if you see here, there is a gap between the skin and the tube. So that means that the hearing aid can be pushed further in your ear. So use your little finger and then try to push all the way in. So this is sitting right next to your ears, at the skin. So that's how this has to go in your ear. Now also make sure that you put the right hearing aid in the right ear and the left one in the left. So identifying the right and left is the first step. Also sometimes it helps to take someone's help if you have difficulty putting them in. So sometimes it's if you have a caretaker or if you have someone at home, you can take their help to put them in properly in your ear. Sometimes even pulling your ears backwards also helps the ear canal open up, so it's easy to push the dome inside. So these are some of the things how you can put the hearing aid in properly. So some people also develop their own ways. After practice, they have their own ways to put the device. There is no correct way, but once you put the device in, it has to sit properly. So if you're not hearing properly from the device, it might be because you've not put them in properly in your ears. So if you have difficulties putting the hearing aids in your ear properly, so just go back to your audiologist, explain them so they can work out a solution for you. Thank you.